Hello everyone. Now I'll be discussing question of psychiatry. Well, we have a 67-year-old man, and he has been complaints of extreme forgetfulness for last 6 months, and he fear he's developing dementia like his father. I used to be very bright and sharp person. Now I can't even concentrate to work or read book or newspaper. I'm extremely low and useless. He is tearfully sharing his problem. He is hypertensive, hypercholesteremia, diabetes, benign prostatic hyperplasia, 67-year we expect, and transient ischemic attack is also there. That means stroke history is also there, predisposing factor. Well, family history is significant for hypertension, diabetes, Alzheimer's disease in his father. CT scan of the head is normal. Most likely cause of his cognitive impairment is, well, in this case, the answer is major depressive disorder. Why this? Why not others? This patient symptoms are consistent with major depressive disorder, what we call as MOD. Well, in this patient, there are cognitive impairment, low mood. He feels I'm useless, feeling of worthlessness, sleep disturbance, low energy. All these are due to depression. He knows he's worried about his forgetfulness. He's tearful, he's repenting, and he's scared that my father died of Alzheimer's. So why not? Even I can have. Psychomotor, you can say slowness, retardedness, slow speech, thinking, movement. They're all the part of major depressive disorder. Well, is an elderly man who are extremely depressed, often present with memory loss, and that is sometimes known as pseudo dementia. We know very well in dementia as such, memory loss is the main problem, like Alzheimer's disease. But his pseudo is not Alzheimer, but it's his forgetfulness. So why we are saying that this patient has pseudo dementia, deficit in attention, concentration, memory, executive functioning can be seen, but are often compounded by poor effort during testing. Well, before I proceed further, I have two questions for you. Write down the answer, stop the video, write down the answer. Here we are talking about pseudo dementia because of depression. Now tell me, deficiency of which vitamin deficiency can cause dementia-like picture? And similarly, in which endocrine condition most likely we can have dementia-like features? Stop the video, write down the answer. Well, which vitamin deficiency can produce dementia-like picture is vitamin B12. And endocrine condition which can cause is hypothyroid. That's why whenever you are talking about any dementia case, never forget to rule out vitamin 2, B12 deficiency and thyroid problem. And one more thing, subdural hematoma, and of course HIV is the new thing to come up. Of course, in the good olden days, it used to be neurosyphilis. But nowadays, we don't see neurosyphilis, but HIV has replaced that thing. So these are the few things that you should rule out before you really make a diagnosis of Alzheimer's disease. Yeah. Well, these patients are at higher risk of developing dementia later on. These depression-related cognitive impairment is usually reversible and improved with treatment of the underlying depression. Because this is not a true, it's a pseudo-dementia, is definitely a treatable condition. Now, let's look into other thing. Alzheimer's disease is the most common cause of dementia, irreversible dementia in the world. And this you can differentiate because apraxia and agnosia are the features that we see in Alzheimer's disease, and these are not seen in depression. And moreover, the patient is really concerned about loss of memory, a depressed patient, Alzheimer people, they already have loss of memories. They are not worried about memory loss. Okay, well, and moreover, these dementia are typically brought for clinical attention by their family people. They bring for the memory loss. Now I have a question for you. Stop the video, write down the answer. In Alzheimer disease, about 10% of the patient, well, they start beating the caretaker. You know very well that Alzheimer patient, they need a care just like a small child needs a care. But sometimes these patients, they start beating the caretaker. What is that condition known as? Stop the video, write down the answer. Well, the answer is Capgras syndrome. Patient think that the caretaker is the enemy and they start beating him. Well, normal aging process that lead to some sort of memory loss, that's quite possible, normal. But depression is still more likely in this patient due to presence of associated depressive symptom and are causing clear functional impairment is there. Parkinson patient, classically they have slow movement and depression, and they usually have other features also like rigidity, mask-like face, shuffling gait. It is such a classical thing. If you are getting any question, you are getting shuffling gait, you should always think about Parkinson. Well, this patient shows slow movement due to psychomotor retardation, one of the diagnostic criteria of MOD. Well, we talked about mask faces in Parkinson. Now I have few questions. Stop the video, write down the answer. Tell me in which condition you see snarling face. In which condition you see mouse-like face. In which condition you see chipmunk face. Okay, stop the video, write down the answer. Well, starling gait, starling face you see in myasthenia gravis. Mouse-like face, chronic renal failure. Chipmunk face we see in thalassemia. Well, vascular disease, patient age and medical history of hypertension, hypercholesteremia, TIA, definitely strongly favored toward vascular disease, definitely, so-called vascular dementia, VD what call as. However, CT scan is normal, okay, and moreover, in this, in our patient is more of a acute onset of disease, and in vascular dementia it is step ladder dementia occur like this. Patient stable for some time, again deteriorate suddenly. That pattern is not seen in our patient, but it's a close contender is this. Well, golden line to remember, elderly patient with depression often present with cognitive impairment that may mimic like dementia. Impairment usually reversible with treatment of the underlying depressive disorder. Thank you very much.